So to expect other providers to think in short-term and long-term goals, that's so unique to rehab that they're not going to do that. So they're not going to think to break down a person's day or functional ability or mobility or the spoons, right? If they're having the 12 spoons with the spoon theory and they're only starting with 6 for the day and it takes them 4 spoons just to get the kids up and out of bed to school and they're left with 2 for the day. So again, making sure that, kind of like that entry level open and closed ended conversations, with patients is something there. Especially we do want to lead them a little bit to really ask. It's like, well, do you have a headache? They may not know what a headache is, or do you have a migraine? They don't know what a migraine is. Well, how about instead reverse that functionally for them? Are you having difficulty going to work? Are you having difficulty getting in and out of the car? Are you having difficulty? And lead them to where people have difficulty in visual, motion, space, and sensitivity, environments like the mall, like the supermarket, and things like that. Do you have trouble driving home or to and from? It's like dark at 4 o'clock in New York, in the winter, and it's, until 9 o'clock in the summer. And, when it's starting to sun up or sun down in that tree, especially in actually winter, it's worse when that light comes through the tree branches and it's that flicker. Do you have more trouble? But you kind of have to ask those questions functionally. And again, you have to kind of be here. You have to see the patients to know that that's their complaints. But again, if we're asking open-ended questions, which is why, again, we like that CCSPT to an extent, because it really asks that point specific and it will start to set you up for success. So you guys are already ahead of the curve, but start to keep thinking functionally. So really great questions.